Welcome to my YouTube channel. Today we're going to talk about choosing a nursing specialty. So as many of you guys know, if you've been following my journey, I've worked in a couple of different specialties. I started as a summer camp nurse for special needs children, and then I transitioned to being a heme-onc IMC nurse, which IMC, some people call it a step down. And then now I work in the emergency float pool for COVID patients, and most of my job has to do with more of the case management side of nursing, trying to connect people to resources, but I also sometimes do more of bedside nursing with COVID patients. So just reflecting on my own journey, I decided to make a video about how to choose a nursing specialty, because I know that's something that a lot of new nurses and even people in school struggle with. And actually, there's so many different types of nursing that you can do, and things are constantly changing. So at the hospital system that I was at Johns Hopkins, I worked on a heme-onc unit. So most of my patients had leukemia or sickle cell if it was the heme floor. But we also got solid tumor patients and all different types of cancer and blood disorders. But when the pandemic first occurred, due to changes happening in the hospital, some even med-surg floors became COVID units. Things were moving around so much, and my floor actually became a transplant unit. So it was renal and liver transplant patients mainly, and it was crazy because nurses that have been nurses for 25 years that know their oncology and hematology stuff really well were struggling with this whole new population. And then on top of that, there was a command center. I think it's still in place. I think it's something that Hopkins wants to keep, where basically they didn't call any nurses off. So when you went to work, if you were that extra nurse, they would play Russian roulette with you, and you would go to the command center and have to go to somewhere else in the hospital. It could be a COVID unit, it could be anything. I was floated once, and I ended up on a med-surg floor, I believe, but they specialize in gastrointestinal disorders. So it honestly wasn't bad. The hardest part was honestly finding things, like when I had to do blood draws. Actually, they ended up having phlebotomy do blood draws. On my floor, we did all the blood draws and IVs and everything, but that floor, phlebotomy did it. So I actually didn't really need to draw blood, which I found out later, but before the phlebotomist showed up, and I'm sitting there looking for tubes and things like that. Like, I just hate not knowing where things are. So that was really the hardest part for me in that whole experience. It's just, things are just changing at all times, and you just get exposed to so many different things. But in terms of choosing a specialty, my first tip would just be to be open. You never know where you're going to end up. If you asked me when I first started nursing school if I would end up in oncology, I would say no, because it sounds so morbid. But honestly, I didn't have any deaths. More people live than die, to be honest. And the patients are so resilient, and they're so compliant. And that's what I needed. I needed a floor where people were going to be compliant, because I want to feel like I made a difference in someone's life. And in oncology, you definitely feel like you make a difference. Like, someone can come in and you're just thinking like, wow, I don't know if they're going to make it. And then a week later, they're walking out. It's just really crazy. And it's crazy how fast science is going. And I was lucky enough to be at a teaching hospital that practiced bench to bedside work, which is basically like someone can be the patient's doctor, but they're also working in the lab on new research protocols. And some of my patients were on brand new drugs that have never been used before, and to be on that side of innovation was super cool. So definitely keep your options open. Don't be so narrow. You never know what you might fall in love with. Sometimes we have an idea of something and it's really not that. So that's why my second tip is to network and shadow and maybe even volunteer to get more exposure to different specialties and different types of nursing. There's even things outside of bedside. Like you could be a research nurse, you can work for an insurance company, you can be a school nurse, you could work at a prison. Like there's just so many different things that you can do, and it can be overwhelming to try to choose, to be honest, because nursing's a job where you can go anywhere in the world and you can work anywhere in the world. So there's just so many different industries and fields you can work in, and that's why it's just best to, again, keep your options open and also talk to nurses, learn more about the work-life balance of specific fields, and then also each floor and industry may have its own personality too. So my HEMONC unit might be different from your HEMONC unit, you know? It just really depends on the personality of the nurses and the resources at your hospital. That can really make or break your experience. Find out about these fields, find out about work-life balance, learn if these nurses love their jobs. Like, what's the good, what's the bad, what's the ugly? Get the tea, okay, before you decide to work on a unit or work in a specific specialty. Don't be afraid to ask questions. And you never know what it's like until you experience it, of course, but also get as close to experiencing it as you can. My third tip is to consider your clinical experiences. Like, I knew from my OB rotation that I was not going to be a labor and delivery nurse. I remember the day that I was on the L&D floor. It was me and another student, and they were like, oh, which patient do you want? And I was like, I want the patient that's least likely to have a baby. I took one, she went with the other family. Apparently the resident wrongly effaced the woman, so he thought she was going to go into labor, and she was nowhere near labor, so they sent her home. And then my patient goes and needs an emergency C-section, which was the most beautiful and disgusting thing I've ever seen. I didn't know if I should throw up, pass out, cry, tears of joy, cry, tears of pain. I don't know. And I was so happy to have PPE on, that I had a mask on, because they would have been offended if they saw my face. And I just knew. I had an idea before, but that solidified the fact that I was not going to be an L&D nurse. And ironically, my med-surg rotation was on an oncology floor, and it wasn't the most enjoyable experience, but that was because my clinical instructor wasn't the nicest person. But think about things like that. Do you not enjoy that clinical rotation because it's just not the field for you? Or does it have to do with the floor culture? Or does it have to do with your clinical instructor? Or another factor? Don't dismiss a specialty because you're upset that you have to drive an hour out to a clinical rotation, or because your clinical instructor is Satan's spawn. Like, that has to do with something different. It doesn't have to do with the patients or what you're learning. Just learn to separate things in that way so that you end up making a really informed decision. Another thing to consider, which is nice to look at during your clinical rotation as well, is think about the population that you want to work with. So do you want to work with older adults, younger adults, children, babies? I knew I didn't want to work with babies because I remember in peds, it took me an hour to do one of my assessments because the baby kept squirming and moving, and he was in pain and he didn't want me to touch him, and it was just a lot. I knew that I wanted to just go in, tell you, hey, I need to give you a shot of heparin. Give you your shot of heparin and be out. And oncology patients, most of them want to get better. I would say 99.9999% of them want to get better. So the ones that I worked with were super compliant, and they were ready. They knew their schedule, they knew their regimen, they knew what their meds were for, and it made my job so much easier, rather than working with children where you have to explain to the parents and then you have to deal with the baby, shake a rattle, do this, do a little dance just to give them some liquid Tylenol. Whereas some people love peds. They think adults are gross, and that's true. There are many gross moments, but it depends on what your preferences are and what your personality is and what you're looking to do when you're at work. Even within specialties, there could be different populations. So for example, in psych, there's adolescent psych, there's gero psych, there's adult psych, there's addiction medicine. There's so many subspecialties within specialties, and that's something else to consider when you're looking for a job as well, which I know can be overwhelming, because it's like with the nursing, it's like you can literally work anywhere and do anything. Like you can work anywhere in the world and you can work in any industry. So it is overwhelming to like narrow it down sometimes, but at least try to pick your starting point. Leads me to my next tip, which is keep in mind that this isn't permanent. Like it's not forever. I quit my new grad program 6 months in for various reasons, mainly because I was going back to school, but that in itself is another story, and it's a story time for another time. But just know that it's not permanent. Unless you're locked into a contract, this is the only time that I'm going to say this. If you're not happy, quit. You'll never hear me tell you to quit anything, but if you're miserable at your job every day, then quit. Like, there's a nursing shortage. You will trip and fall on another job. Trust me. And if there's a reason why you can't quit, just know that you're not going to be here forever. You're here for a reason. You have this assignment for a reason. Maybe it's for your long-term goal. If it's not, and you're just there because for no reason, then, and you're miserable, then just quit. Like, if you're miserable, coworkers are gonna hate you, your patients are gonna hate you, and you're gonna hate you. And you didn't go to nursing school to be miserable. We already suffered enough through nursing school. So just keep in mind that it's not permanent, and don't be afraid to leave your specialty if you don't like it. My sixth tip is to think about your long-term goals. So, for example, I knew that I wanted to be on a research unit because I knew I wanted to be a research nurse. So even though I wasn't a clinical research nurse, I worked with a lot of patients who had research protocols. So it was nice to see that whole bench to bedside work, and to work with patients who were getting drugs that have never been used before, and to be on that side of innovation. And if you have long-term goals of going back to school to work in a specific specialty, for example, a lot of people who want to be CRNAs, they need ICU experience. So shoot for an ICU. If you can't get into an ICU, go to a step down until you're able to get an ICU job, and just work in that way. Just keep your long-term goals in mind so that you don't end up wasting time. If you want to be a CRNA, there's no reason why you should be doing 5 years on a med-surg floor. And don't let anyone tell you that you have to start in med-surg, because you don't. I started as a summer camp nurse and ended up on a step-down unit. I know a lot of people who started in ICU units. I know people who went from med-surg to ICU and still struggled because it's a different specialty. And that leads me to my final tip, which is to just be patient with yourself. Whether you're a new nurse or you're a seasoned nurse, just switching to a new specialty, just be patient with yourself, and just know that you're not going to know everything. Somewhere in life, I don't know where it happened, but I accepted the fact that I don't know anything, and I rest in that. I have peace in that. And even through this PhD program, and even as a new nurse, I had people tell me like, oh, I cry every night, like, you know, how do you do it? And I'm just like, I just take it a day at a time, and I know that I don't know anything. So if I go to work and something happens and it's because I didn't know, it's like, oh duh, like I'm new, like I don't know. You know that little Uzi meme? I don't know, I've been here for 3 days. Like, that's really my attitude, like I don't know. And if I go to work and I do know something, then that's a victory, you know? Just know that you can't know everything, and don't compare yourself to others, because there's some people that confidently and ignorantly walk around like they know everything, and they really don't, and that's a patient safety issue in itself. And then there's people like me that you think know everything, but I'm really just sitting here resting in the fact that I don't. And I'm okay with that. Like, I love learning. I love learning new things, and that's really the perspective that you have to have. Like, just not being hard on yourself, being kind to yourself. You didn't go to nursing school to graduate and be miserable, like, and you know more than you it's a contradictory statement because you really know more than you think, because you studied so much through nursing school. Like, you took the NCLEX, you're super smart for doing that. It's just that applying the knowledge sometimes is hard, and sometimes you get to the bedside and you're just like, this is not what I read in the book. But so you're learning a whole new thing, you're learning a whole new field, so be patient with yourself. I've heard some people say it takes like a year for you to feel comfortable in your role. Everyone's different in that regard. So again, don't compare yourself to others. And again, if you're absolutely miserable, don't give yourself a year. Like, get out of there, run. Like, there's no reason for you to be miserable at work, and especially not in nursing, because there's so many things you can do even outside of the bedside, and so many different specialties that you can work. So that's all that I have for you guys today. Don't forget to like, subscribe, share this video with your friends, watch it again if you'd like, and tune in next time.